Thank you. My name is Diana Clynes. I am the Executive Director for the American Association of Kidney Patients, and it's a real true honor to co-host this global summit event with our friends at GW University. I've just been very impressed and excited about all the wonderful presentations that have gone on, and Dr. Walsh and Courtney really set me up well to share a bit about my slides, where we've heard a lot about clinical trials and patient engagement, and I'm going to spend some time telling you about what AAKP is doing nationally and expanding globally to really support that effort and get patients involved. And so about 4 years ago, AAKP's National Board of Directors implemented a new national strategy that really encompassed 2 centers, which clearly defines AAKP's capacities, initiatives, and programs. So our first center is a Center for Patient Engagement and Advocacy, and this really entails AAKP's advocacy efforts on the Hill, our action center, activating those patients when there's policy issues, legislative issues that really need the patient voice, contacting their congressmen. We partner quite frequently with the American Society of Nephrology, the Renal Physicians Association, AST, ASTS, all the physician professional associations when they go to the Hill, because it's a really impactful partnership when you are talking about an issue and you bring a clinician and a patient. So you get that clinical background, and then you get the real world perspective of how does this impact a patient, how does this impact their daily life. And on our engagement side, we've really expanded to reach out further out into the United States and into local communities and into states. And so within our engagement center, one of the highlights of this center is our ambassador initiative, which was developed by my colleague, Erin Kale. And our ambassador initiative is identifying basically our supercharged volunteers, whether they're patients, caregivers, living donors, those who really have a presence in their local community. They're social media influencers. They really stand behind the message of getting the patient voice out to the community. So we've been really successful over the implementation in 2017 of this program, where we're now up to over 120 ambassadors across the United States. And we've just launched our global expansion of that with ambassadors in Canada and Ireland. And as Paul mentioned earlier in the comments, that we will be making an announcement of all the other countries that we've been associated with and contacting with to really bring together a united front across the world to fight kidney disease. And for our Center for Patient Research and Education, this center really hits home to what we've been talking about today and what we're going to be talking about tomorrow as well. AAKP is the oldest and largest patient organization in the United States. We have a really robust database that we're continually finding additional data collection on about our constituents, so that way we can partner with all sectors of the kidney community, whether they're private sector, our industry partners, partners such as Continuum Clinical, to really identify those patients that would be eligible to participate in market research, that would have an interest and qualify for a clinical trial, to really let them know about the opportunities that are out there. And within our database, we can geo-target, we can segment the database so we can be as efficient as possible when we're doing that outreach with our patients. We quite frequently recruit patients for surveys, focus groups, cognitive interviews, and we've really found that it's very easy for us. AAKP is a very trusted source among the renal community, and the patients and their caregivers, they really want to have that voice. And as Courtney mentioned, there has been a paradigm shift over the last 10 or 15 years where you really can't get anywhere without starting with the patient first. So during the past 16 months, AAKP has been contacted by a number of companies, over 63 companies, investment firms, major investors related to trial and research. And as Dr. Walsh mentioned, it's really wonderful because AAKP is helping pull that patient in early in the study process. So we've been involved in study design protocols, patient consent forms, really getting that patient to or those ambassadors to review the material to make sure that it's understandable that this is a trial that is actually going to identify and fill a need and a void that's out there for the patient and their quality of care, their quality of life. And this is just a quick slide. It's not all encompassing, but it's just a quick representation of a lot of AAKP's partners, our professional association allies that we partner with quite frequently, our industry partners, and then we also partner quite frequently with federal agencies, CMS, CDC, NIH, HHS, all the alphabet soup that is out there to help identify patients for their needs, for them to hear their voice, and to also connect them with patients that you can't normally find on normal communication lines. They may not be on social media. They may not, be savvy with email, but AAKP, through our ambassador program, through our networks and our partnerships, have been very successful in identifying that community, which is really the underserved community and really those people who need to have a voice in a lot of these trials and the innovations that are coming. And as I mentioned, our National Ambassador Initiative, we are close to locking down all 50 states, which is really exciting. As I mentioned, we're up to over 120 ambassadors who have their own networks and continually push AAKP's message, opportunities for patients to participate in advocacy, research opportunities. They represent us at conferences, technical evaluation panels, coalitions throughout the renal community. As I mentioned, by fall of 2020, we do have a very ambitious goal of having over 400 ambassadors for each congressional district. And we saw this slide earlier today, the heat map. Kidney disease knows no bounds, and so it's really wonderful that we have so many countries represented today, and we're having this discussion, one of many discussions we'll have. And this is really why AAKP is being very aggressive with our global expansion. We have been contacting and working with our international counterparts for some time, but we're really working to formalize all of that and really launch our global expansion. We kicked off our global expansion initiative in May of last year when Dr. Mary Smith invited us to Paul Conway to the United Nations talk to speak. So that was a great opportunity to kick that off, and just a sampling of some of the countries that we have been in contact with to lead that expansion effort. And just to kind of highlight, and Courtney really kind of highlighted a lot of what I'll probably be just flipping through, but AAKP does a number of what we call flash surveys, and it's a really great opportunity to get some really quick information from patients and caregivers about a particular topic. These surveys are pretty much live for about 48 hours, and we get hundreds, thousands of responses depending on the topic. And we participate in IRB and scientific surveys as well, but these flash surveys really give some great raw data and information that we can share with our partners, that we take when we're having conversations with representatives at the legislative and executive branches. And so we recently did one on patient insights on clinical trials. And I'll just kind of roll through some of these questions, but when asked and respected, kidney patients will honor the ideal of placing their suffering in service of others. So as you can see, with the question of, would they be, as an individual suffers from kidney disease, if they felt their insights were valued, would they participate in a trial? And the answer is an overwhelming yes. And have you ever been asked to participate in a clinical trial? The answer is no. So as Courtney had mentioned, talk to your patients about clinical trials that are going on. The clinicaltrial.gov isn't always a user-friendly website for patients, so that's why advocacy groups like AAKP, we have a page on our website where it's really easy for patients to search about trials that they're interested in. When we partner with what we call clinical trial awareness campaigns, we're raising awareness about opportunities for our constituents to get involved. And then just rating the experience. A lot of patients, when they do get involved with trials, they do have a good experience. And I think that has a lot to do with paying it forward. Whether you participate in a trial or not, which one of the following do you consider the greatest risk? We were able to identify that patients felt that the greatest possible risk was to their overall health. So a lot of these flash surveys are getting questions that we can then provide responses to our partners that'll help them tailor and get some insight into how can they develop the conversation and the material for their clinical trial. What's of most concern to patients? What should they address up front, and how should they address it? And then there's just, can flip through some. But this just gives an opportunity of one of the many capacities that AAKP has. And again, we partner quite frequently with Duke and Emory, Northwestern, UPenn. AAKP is a great resource to really get in touch with the patient and get that patient voice and involved in all of your projects. So, thank you.